Hello, my name is Maddie Nemeth, and joining me today is Kendra Kerner. And we are doing our 2-minute pitch on Case 3, Should We Have Universal Health Care? So our position that we are taking is the United States should have universal health care. There is a moral obligation for the government to provide basic public health services regardless of racial, ethnic, or geographic groups. It is a basic moral obligation of charity or beneficence to provide for those in need. Application of beneficence is to provide resources for minimum form of health care. Failure to achieve public health arrangements that meet a reasonable standard of equal protection to all is an injustice. Uneven distribution evokes moral concerns of beneficence. Liberals wanted a healthcare system that would protect all Americans from the pain of illness and burdens of medical bills. So therefore, everyone should have a right to universal healthcare coverage.
A major advantage of a single-payer system is that one can attain universal coverage at a lower cost. Canada has universal coverage with excellent health outcomes, minimal paperwork, and high public satisfaction. Avoidance of risk selection is a key advantage, meaning that everyone is insurable. There are more uninsured people in the United States than the entire population in Canada. In 1998, the U.S. spent more per capita for public funds for health care versus Canada. Allowing all Americans to be insured promotes justice to human rights. Therefore, the United States should adopt a universal health care system. Human rights are inalienable, meaning they are a legal claim that citizens have against the government, not moral, to provide. Human rights are indivisible, meaning everyone receives them and the government facilitates this. Human rights stem from historical context. An example, it is hard to prevent the spread of AIDS because of discrimination against those infected. Not treating them violates human rights. The government obligations include non-interference unless rights are at stake, actively protecting human rights, an example, the regulation of scientific studies, and putting laws into effect to fulfill human rights. Therefore, it is a government obligation to promote human rights. Government is not responsible for healthy people, but it's obligated to provide people with an opportunity to be healthy, and humans have a right to be healthy. Those who lose the natural lottery or are born with disabilities or diseases will need to challenge the distribution of resources to get what is due to them. This includes equality, fairness, non-discrimination, and justice through human rights. Health is required to achieve other aspirations, and human rights are dependent on healthy people. Therefore, universal health care is a human right.